Hi everyone, I'm Lisa, this is Joanne, and this is Tina, our fibromyalgia client who has graciously volunteered her time for our video today. Our topic, we decided to do a review of outcome measures on fibromyalgia patients, specifically the fibromyalgia questionnaire, and their uses and benefits with clients and treatment planning.
So the first thing that we're going to do is we're going to illustrate Tina having a first appointment with a therapist who does not use the fibromyalgia questionnaire. My name is Joanne and I'll be your therapist today. So what I want to know first of all is what it is that you're seeking from treatment today. What are you hoping to achieve?
Well, I'm tired a lot, I'm stiff, I have a lot of constant aches and pains, so I'm looking to have some of that reduced.
Okay. And specifically, where are you feeling your aches and pains?
Generally, mostly in the upper body,
Okay.
but in around the hip and leg area as well.
Okay. Is this pain limiting any of your daily activities at all, like cleaning the house or?
Yes.
Okay. And how are you with personal hygiene, taking care of washing your hair and things like that? Is there any difficulties with anything like
Now
that?
I seem to be able to manage with that.
Okay. So what we're going to do today then is we're going to focus treatment on your upper body. We're going to focus on getting some of that pain reduced for you, okay? Okay. Hi Tina, nice to see you again this week. How are you feeling?
Same as last week.
Okay, I don't actually remember how you were feeling last week, but I did have a chance to go over the treatment notes from last week and what we did. So what I'm going to do is I'm just going to do the same thing again this week, and we'll see how it goes.
We had terrible winds here.
Okay.
Hi Tina, I'm Lisa, I'm going to be your therapist today. How are you feeling?
Not very good.
Okay, well I'm sorry to hear that. Is there anything specific that you're having trouble with?
Neck and shoulders
Neck
are
and shoulders.
always a problem.
Okay. What I'm going to do is we're going to start by having you fill out a fibromyalgia impact questionnaire. Just ask you some basic questions about your daily activities and how you're able to perform them and not perform them.
Okay.
So how about you just fill that out for me? And this will also help guide us in how we plan our treatment, as well as show you the progression each week when I have a record of it. Hi Tina, how are you doing today?
A little bit better.
Good, excellent. We're going to start again the treatment. Before we do treatment this week, we're going to start again by having you fill out the same questionnaire that you did last week and see how your responses compare to the responses from last week, because I have last week's right here in your file.
Okay.
And we'll be able to determine if you are showing any improvement and whether the treatment was effective that we did last week. And then we'll be able to modify it or not modify it if it's working for us. Okay, so I'll just give you that and a pen, and away you go. So I'm just going to review the questionnaire that you just filled out for me at the second treatment, just to show you, just to take an opportunity to show you the differences. As you can see here with the laundry washer dryer, you were not able to do it at all last week, where this week you were able to do it some, as well as preparing meals, washing dishes, cooking utensils with your hands, and making beds.
Wow.
So, that's excellent. We will refocus the treatment. We know that whatever we did last week is working, and we'll continue to work on that and add a little bit more in at the same time, as long as you're able to handle it.
That's great.
Sounds good?
Yes.
Excellent.
So Lisa and I were able to review 3 articles with respect to the use of the fibromyalgia questionnaire with fibromyalgia patients. And what we learned is that the fibromyalgia questionnaire does have a good discriminating power. However, it is best used in conjunction with other questionnaires as well, like the Visual Analog Scale or the McGill Pain Questionnaire. The benefits of using the questionnaire, which we were trying to illustrate in our video, is to be able to show the client a tangible improvement or lack of improvement with specific symptoms that they're feeling. It's an objective measure of subjective information, basically. It's a quick reference guide Whereas when I was treating this client, I had no idea what she was feeling like last week because I couldn't remember. Lisa was able to quickly see how the client was feeling this week in comparison to last week, just by pulling out the questionnaire itself and not having to decipher through all her notes and things like that. In a multidisciplinary clinic, the questionnaire would be quite useful. For example, if your therapist was ill and couldn't come in that day and another therapist was seeing you for your appointment, they could quickly go into the file, pull out the questionnaire, and be able to determine the progression of your symptoms or the lack of progression of your symptoms just based on the information in the questionnaire. It's kind of a quick snapshot. So the only thing that we would want you to keep in mind is that there is a certain element of interpretation of the healthcare practitioner. However, it's quite a simple way to be able to see how the client is feeling overall.